Hi, this is Terry Kuti with DiepCFoundation. I am very honored to have two board-certified ASPS microsurgeons with me today. I have Dr. David Song with MedStar Georgetown, and I have Dr. Minas Chrysopoulo from PRMA in San Antonio. Welcome, gentlemen.
Hello. Thank you. Thanks for having us.
So I have an interesting question because on the Facebook page that I admin, sometimes I get this question from women. It's not really a question, it's a comment. They will have gone to their plastic surgeons and they are told, I was told I'm not a candidate for autologous or using my own tissue breast reconstruction. So I'm going to let you two take it away and talk about this topic. It needs to be discussed.
Yeah, and I think as an experienced microsurgeon, I get that a lot. I'd say about 30 or 40% of my patients when I was in Chicago, and now about 50 or 60% of my patients in DC have already seen another plastic surgeon. And they're all my colleagues, but many of them are not comfortable or have additional training in microsurgery, or they don't do a lot. So for them, pushing the envelope and doing stacked DIEPs or even 4 flaps for 2 breast reconstructions is a Herculean task. And so when I see patients like that, I always remind them that there are other autologous options for breast reconstruction, and we can talk about the different sites, the donor sites. But truly, I think you owe it to yourselves. Patients need to know that getting a second or third opinion, especially from someone like Dr. Chrysopoulo, who has a lot of experience in microsurgery, myself, who does a lot of microsurgery. You know, it's rare, it's extremely rare that I see a patient who's not a candidate for some sort of autologous reconstruction.
Yeah, absolutely. I would agree with everything you just said, especially when you're in a practice that accommodates people traveling. You know, that's a very big reason for patients to travel, because they're told locally that they're not a candidate, and it's usually for 2 reasons, especially for patients seeking the DIEP flap procedure, which is the most commonly performed lower abdominal procedure these days in terms of reconstruction. Probably the pedicle tram is probably still more common, isn't it?
I would think so, yeah.
But in terms of patients advocating for themselves and seeking out procedures, I think the DIEP flap is probably the most popular now. There are 2 aspects. One is, oh, you're too thin, and the other is, oh, you've had previous abdominal surgery. So thin ladies are still candidates for autologous tissue reconstruction. It's not your weight. Ultimately, it's how you carry the tissue you have and how it's located, where it's located, and what the goals are. And then in terms of surgery, there are some surgeries that will preclude using the lower tummy tissue, like a full abdominoplasty. You're not going to be a DIEP flap candidate. I think there's been 1 case report, but you're not going to be a candidate. A cesarean section, it's very unlikely that you won't be a candidate. So it depends on the procedure. Multiple abdominal procedures increase risk, but then we can do preoperative CT angiograms and testing to see if you're a candidate ahead of time. But as Dr. Song mentioned, there are typically ways to make up for tissue. You can use multiple flaps in 1 breast. You can use 1 flap and then come back and inject fat into it. Some surgeons will come back and put an implant under a flap, under the DIEP flap. I don't personally like that option, but it's certainly an option. But there are always things to discuss if you're having this conversation with someone who performs these procedures day in and day out.
The one other comment that I'll say is, again, everything that Dr. Chrysopoulo said is absolutely germane to our discussion and what I experienced virtually daily. But other times patients will come in and say, I saw Dr. So-and-so down the street who's a great plastic surgeon, and he or she says, oh, you don't want the DIEP flap, it's a 12-hour operation. You know, I hear that a lot, and I think when you go to someone like Dr. Chrysopoulo or someone that has done a lot of these, it's not a 12-hour operation. It's typically for a unilateral, it's about 3.5 to 4 hours.
Mm-hmm.
For me, I'm maybe a bit faster for you, but it's you know, you need to seek the answers and you need to do your homework. And I think that's the key, is to seek someone that's obviously a board certified plastic surgeon by the American Board of Plastic Surgery, someone that has experience with microsurgical flaps. And I think that's where some of these answers and these myths can be debunked.
Right. And I think the point that you made too, that travel may be in that mix if they, need to get a second opinion and go to a different microsurgeon. I traveled 800 miles to go to see Dr. Chrysopoulo. It's so doable. The planning, sure, it's there, it takes place, but it's doable. And I can tell you unequivocally, it's worth it. So don't be afraid to seek a second opinion just because a doctor has told you you are not a patient for autologous breast reconstruction. Thank you both so much, Dr. Song and Dr. Chrysopoulo. This has been a great conversation.
Yeah, it was great.
Thank you.
Hopefully gives women some hope.
Yep.
All right, thanks.